The National Association of Resident Doctors, NARD, has commenced an indefinite nationwide strike, accusing the federal government of repeatedly failing to honor agreements reached after several rounds of negotiations. According to the president of the association, Dr. Muhammad Suleiman, the decision followed a 5-hour National Executive Council meeting and was driven by unmet demands, including salary arrears, poor working conditions, inadequate staffing, and lack of essential medical infrastructure.
Once the federal government announced plans to release 11.995 billion naira within 72 hours to clear outstanding arrears, including accountment and other allowances owed to health workers. Well, the Minister of State for Health, Dr. Adekunle Salako, assured that ongoing issues around salary reviews, promotion delays, and certificate categorization are being addressed. But let's not just take it from our mouth only. This time, we're being joined by the president of the association, Dr. Muhammad Suleiman. Good morning.
Good morning. Thanks for having me.
Good. It's not so good news, especially with what we've gone through over the weekend, struggling with insecurity issues, Nigerians also battling with the story that comes from the United States and so on. And then we now hear that the association is also going on strike. Medically, everyone is starting to think what will happen. But given the federal government's latest promise, to release this huge amount, 11.9 billion naira, and also pay the arrears, what specific assurances does NARD require before calling off the strike? Or are you still on strike, by the way?
Yes, we are. Thank you for having me. Good morning to our viewers. We have a series of 19 demands. These 19 demands touch at the heart of healthcare service delivery in Nigeria. As you are aware, resident doctors form the backbone of healthcare service delivery in our tertiary healthcare facilities. 12 years ago, we had about 16,000 resident doctors just at the federal level, 6,000 to 7,000 at the state level, about 1,000 spread across private tertiary health institutions. Today, I am very, very unhappy to report to you and our viewers that at the federal level, we have barely 9,000 resident doctors. At the state level, we have barely 1,500 resident doctors. At the private healthcare facilities that are affiliated to NARD, we have barely 200 resident doctors. That number jumped by about 50% in the wrong direction. You now also have a population increment from maybe conservative estimates say we are closer to 280 million. These are public health estimates, not NARD's estimates. What are the reasons for this? Our certificate, our membership certificate has been recategorized from a specialist status to just plain additional qualifications. This was described by government as a routine thing. It is not. It strips us of our academic pursuit, excellence. One might even say, if you go to Ghana, that same certificate recognizes you as a specialist. If you look at working hours, the treasurer of NARD now is a senior registrar in plastic surgery. He has been on call as the only senior registrar in that unit in his own hospital since February. There's a call roster that is flying around on social media, and I went to Lokoja to confirm this from FTH Lokoja. Dr. Victor Audu and Dr. Yomi, they are the only two on call for the entire month of October, second on call for the entire month of October in the orthopedics department of FTH Lokoja. Yomi is taking 31 calls, Victor Audu is taking 22 calls. These are doctors that are tired, that they are burnt out, they are exhausted from excess workload. If you look at other issues, like even in that FTH Lokoja, 5 doctors were unjustly terminated simply for highlighting union challenges that needed to be addressed. One of them was the sitting ARD president, one of them was the sitting vice president, one of them was the sitting center secretary, one of them was a past ARD president and immediate past chairman of the entire state, terminated simply because they protested inadequacies in terms of the welfare of doctors in those centers. What are the other issues that we're talking about? Promotion arrears. For about 5 years since 2021, no promotion arrears has been paid to medical officers in the entire civil service of the federal government. These are very, very unfair things. Let me give you an instance. In FMC, for instance, There are doctors that have been recruited since last year that have 4 to 8 months arrears. If you look at OAU THC in Ile-Ife, we have about 83 doctors that have arrears. We have another 40 that have arrears of different periods of their service. Go to Benue State University Teaching Hospital. 18 months worth of arrears is being owed to doctors. These are the realities that we live with every day, every day. It is not new. When you reduce it to 11.9 billion, it makes it look as if doctors just want to come and collect money before they go back to work. Now let's even talk about that 11.9 billion. What I am aware of is that on Thursday, and I would hope President Bola Ahmed Tinubu will commend the Minister of Finance, Mr. Waledun, will commend the Honorable Minister of State for Finance, Dr. Doris Aniti, for their swift action to handle issues that came to their table with respect to our demands. Now, on Thursday, we had conversations. There's what is known as the accoutrement allowance. This is an allowance that has been raging for over a year, not paid by federal government. And 2.9 billion was released, hopefully to land with IPPIS today or tomorrow. Another 2.4 billion was released as non-clinical duty allowance. These are for consultants exclusively, not resident doctors. Another 400 million was released as COVID-19 backlog allowance. This is for other health workers, Johesu, under the banner of Johesu, not resident doctors. If you combine these three figures, you get 6 billion naira. That is what we are expecting, so that some of these backlogs can be cleared. But then I'm now seeing that it is 11.9 billion being released today. I don't know where the extra is coming from. Perhaps the Ministry of Health will clear the air on what the extra is meant to do. Let me also commend the Minister of Finance, the Minister of State for Finance, for clearing a 2-year arrears of 25-35%, not just for CONMES, which is the salary structure for doctors, but for CONHES, which is the salary structure for other healthcare workers, including admin staff. The 40 billion released, over, I think 10 billion came in August, 10 billion came about 10 days ago, then 21 billion came last week. This is for 25-35% arrears for the entire health sector, for the entire body of those who work within the health realm of Nigeria at the federal level. Perhaps if you break down the 40 billion, about 10 billion will go to doctors. You are aware resident doctors make up about 60% of the entire population of doctors in Nigeria. So that 10 billion, probably 6-7 billion was what went to resident doctors. So let us not come out here and make it seem as if doctors are hungry for money. It is beyond money.
Okay, talking about Dr. Suleiman.
They terminate people unjustly. When you don't pay promotion arrears, in fact, let me specifically talk about one item, professional allowance table. We have a CBA from 2009 that was reviewed in 2014 that says anytime federal government reviews the minimum wage, which affects basic salary, it should also affect our allowances. We're not even taking it back 16 years ago. We're just talking about 2019. Till date, our allowances have not been adjusted to reflect these minimum wages. Now we're asking federal government, the tables are ready. They are with Salaries and Wages Commission. We are asking them simply to release these tables. We can talk about the budgetary things, the areas later, but release it. Correct this injustice. No, federal government is telling us we have to wait for the current collective bargaining that has been stalled. It's not progressing. We don't even know when it will restart. We don't know when it will end. We have to wait until that ends before an injustice that has lasted decades. But we're not even talking about the entire period of the 15, 16 years. We're only talking about 7 years. So that Nigerians will understand it is beyond just money. It is about the dignity of the doctor, about the dignity and the structure of the healthcare system as it is. We can't continue to bleed out.
Thank you,
doctors bleed them out.
Thank you, Dr. Suleiman. You've given us an overview of why you've decided to strike. And from what you've listed, it's way beyond money, and money is just scratching the surface. There are issues of work conditions, your certificate, the work environment, and what have you. And it's really sad this is coming at the back of Nigeria being declared as a country with the lowest life expectancy in the world at just 54.9 years old. Quite a tragedy. Now, that brings me to my question. Beyond the monetary issues that we've talked about, and you've commended the Federal Minister of Finance and the Minister of State for Finance for, clearing a bit of the backlogs. How about the other issues of promotion, the certificates? Who are the stakeholders involved here? And what has the negotiating process with the Ministry of Health been before you decided to take this action, industrial strike action?
So for about 3 years, NARD has not gone on strike on any of these issues. These issues, some of them have lingered for, like the certificate issue since 2019, the promotion arrears issue since 2021. Other issues are even longer than that. There's an entry-level crisis now. Government has decided that the entry level that doctors go into civil service instead of COMMES 3 is COMMES 2. That should changes doctors. My members, resident doctors, by about 100,000 at the entry level. There's an upgrade problem. When you pass exams as a resident, you're upgraded to a senior resident. That upgrade process has stalled over the last 1 year for some bureaucratic problems. There are arrears accruing. We have that peculiarity, and that is not being addressed. Now we have talked about this for a long time. In fact, in September, specifically 14 September, this association went on a 2-day warning strike just to press home these demands. We called off that strike, and there was a 2 weeks ultimatum given to federal government that landed at the AGM that brought my leadership into office. And when I came in, the AGM said, no, you're coming in new. Let us not take an action. Let's give a 30-day window. We ran from pillar to post within those 30 days, talked to whoever we could, and there was even no sit down until around day 25, 26. And then even at that was the only engagement. Nothing was put on paper. Nothing was agreed upon. It was more like, come and say these are our grievances, and government says, we have heard these are your grievances. And that was it. And then when we had the Emergency National Executive Council meeting, because I was summoned by the NEC, and I was asked to give a progress report, and there was no progress made whatsoever. And the National Executive Council further added another 7 days. So look at it. This is the 30 days, 7 days here, 2 weeks there, years in the past. These discussions have been ongoing. What is the bane of this discussion? You agree on things, you take people at their word, they tell you we will do this, you believe them, you go back and convince your members. Now the members are tired of hearing promises from the lips, promises from the mouth, not promises that are coming from deep within the heart that will be put on paper. For instance, the membership recategorization issue. It is claimed that the MDCN does not have a council. It is also claimed that the minister sits as council in the absence of a council. What stops the minister from writing a paper, clarify this issue? The colleges have made it clear. The colleges, there was a conversation where a member of the college made it very clear these certificates are on category B, which means they are supposed to be at a specialist status. Finalize it, discuss it. There's a specialist allowance that is attached to that specialist status, especially for senior registrars. When are they going to start paying that? And the COMMES circular specifically takes care of that specialist allowance at COMMES 5. Now here comes people from head of service to say that no, SR1s are not supposed to be on COMMES 5, downgrading them to a grade level lower than that, even downgrading entry level to a grade level lower than that. I mean, these are not tenable. The circumstances are already bad as it is. We're not asking for anything new. I've not mentioned anything new in our communique that start this new. It is all promises that we're talking about that you have to fulfill your own part of it. We fulfill our side of the bargain. We have been at work. We've been working for all these years, for all these promises that we have gotten. Now, members are already tired and frustrated. It will interest you to know that this time around, all the centers in NARD held Congress meetings and all agreed on total indefinite strike action. It is our expectation from what we are hearing through the grapevines that the Federal Ministry of Health will even start no work, no pay from today or from this week. Members are ready for that. You want to not pay us for work we have done, then we will not work for the pay that you are not giving.
All right.
So that is the extent of the frustration as at this moment from members. And our hands as national leaders are tied.
All right. Doctor, we'll go on a break now. When we come back, I want us to delve deeper into what the reality, of if you can maybe run us through very quickly in a few seconds. What is the reality of the everyday Nigerian doctor? What is the reality of how they live their life? I recall we talked about Dr. Oluwafemi Rotifa on the show as well, the unfortunate death of this doctor who was overworked. What is the reality of the average Nigerian doctor?
So you come to work on a Monday, you go for a morning review. Of course, your seniors interrogate you about the previous day's admission. You have an academic discourse, and then you go to work 8 to 4. And if you're on call that day, from 4 you're on call, you review all the admissions of that day, and then you sleep over in the hospital till maybe 8 a.m. the next morning, and you go back to that morning review again, where you'll be interrogated about the previous day's admission again. And then you continue to work from 8 to 4. Again, if you're not on call that day, by that 4, that's after 32 hours of work, you go home. Unfortunately, which is the reality now, if you're still on call, you continue that until the day you're not on call. For my treasurer, who is the only SR in his unit, that is a perpetual thing. He has to steal time. Look at when patient load is less, to go home, see his family, see his kids, probably freshen up, and then come back to the hospital again. For Dr. Yomi and Dr. Victor Audu and others that have their similar situation, you're glued to that call room for the entire duration of the month. That is a typical example. Then at the end of the day, you're told after going through all this for 3 years, you go for an exams, you pass, and you're told your upgrade cannot come now until after about a year. When the upgrade comes, who knows about your arrears? And then you're told your certificate is not a specialist status. I wonder what you were learning in 3 years. I mean, 3 years of rigorous academic work, of every day going for morning reviews, of everyday ward rounds, of everyday calls, if you're in the surgical fields, of everyday surgeries. The federal government very, very pleasantly gives free cesarean sections. Who carries out these cesarean sections? Resident doctors. Are they paid extra for it? No. In a typical Nigerian hospital, cesarean section rate will probably be about 20 to 30 in a month. With this free cesarean section program, I can guarantee you hospitals do over 50, almost 100 in some instances. And it is resident doctors that do this. There's no extra pay attached to it. And citizens get it for free. So while government creates these free programs, open up new hospitals, it is resident doctors that bear the brunt of it. So what happens to these resident doctors? They are exhausted. They are burnt out. Some of them lose their life, like our colleague. Very emotional. I get very emotional when I talk about him. Our colleagues are frustrated. They are angry. They are hungry. They can't pay bills. They can't pay school fees for their kids. Some have packed their cars. You have to use tricycle, or you have to trek to your work. Because if you live in Katsina, for instance, like I do, it will cost you about 120,000 naira to fuel your car alone in a month to and from your hospital. I mean, how many of us can? I have packed my own car. So this is the reality that every doctor in Nigeria lives with. Now imagine that level of exhaustion, frustration, anger, hunger, that is on you, and you're expected to see what now? In my unit, for instance, an average of 500 to 1,000 patients in a month. In my department, probably about 2,000-3,000 patients in a month. This is not sustainable. And this is work that 10 years ago was being done by 6, 7, 8 doctors. Now it is being done by 2, 3 doctors for a higher volume of patients. So just do the math. Is it sustainable?
No, it's not.
This is the conversation we are bringing to the table. But it's not being made to look as if we are just asking for money. Will money only solve all these problems? No.
I mean, there's the aspect of the brain drain that we see. It's why a number of doctors often are thinking about leaving the country, which does not benefit the average Nigerian. Our doctors are important to us, and we honestly feel your pain. Thank you for taking the time to speak with us this morning.
Thank you so much.
And just to confirm, you have said that if your 19-point agenda isn't met, that the indefinite strike will not be called off. Is that correct?
The National Executive Council has made it very clear that the 19-point demand are our minimum demands. Work in Nigeria must work for the worker, not just the government.
All right.
All right.
Thank you so much, Dr. Muhammad Suleiman, for your time and your insights. President, National Association of Resident Doctors. Thank you.
Thank you.
All right.
Good to be with you.